This is Brainstem with your host, neuroscientist Dr. Hilary Marusak, production by Amanpreet and Manmeet Bogle. Welcome to our special episode on brain stimulation. I'm very excited to speak with our guest for today's episode, Dr. Gregory Fonzo. Dr. Fonzo, would you mind just briefly introducing yourself?
Yeah, my name is Greg Fonzo. I'm an assistant professor in the Department of Psychiatry and Behavioral Sciences at the University of Texas at Austin Dell Medical School.
Awesome. Great. And I'm really excited for today's topic. And I think I'm a little bit biased, obviously, but it's a really exciting time to be in psychiatry. Usually we think about psychiatry, their toolkit being of talk therapy or psychotherapy and also medication. But really, due to some really exciting advances in brain imaging and other neuroscience techniques, we're able to understand the brain in a totally different way and understand how brain circuits are wired. And these advances are really changing the way that we diagnose or even treat psychiatric disorders. One exciting area that I'm looking forward to talking to you about in particular is brain stimulation, which is a really exciting way to treat brain disorders. So can you first start off by telling us what the definition of brain stimulation is and then expand on different types?
Sure. So I guess broadly defined, brain stimulation would be where we are introducing energy directly into the brain in some way in order to affect a change in the way that it functions. And so that form of energy can be many different things, but for the most part, it's generally electromagnetic energy. So kind of the electricity / magnetism. And so forms of that are pretty common are things like repetitive transcranial magnetic stimulation, electroconvulsive therapy is another one. And then we also have some newer forms that involve sound waves, something called ultrasound, specifically focused ultrasound. And really the goal with all those techniques is to try to introduce energy in a way that will have an effect on the brain itself to change the way it functions and hopefully have a therapeutic impact on the person who may be suffering from a psychiatric condition or a neurological condition.
Mm-hmm. Yeah, and it's interesting you mentioned things like electroconvulsive therapy. I think people think of kind of the rudimentary, like you shock the whole brain, but it's come a long way since then. So I'm excited to hear more about advances in these techniques. But as we kind of said in the get-go, this is really a paradigm shift from things like medication, which is, something that affects the whole body, or even therapy. So can you talk about like pros and cons of brain stimulation versus these other types of treatments?
Yeah, I think the main advantage is that we are directly intervening on the organ that we believe to be the cause of the condition, right? So most people would agree that a lot of our psychiatric conditions and neurological disorders are focused in the brain primarily. So one advantage to these approaches is that we're directly intervening on that organ in order to be able to hopefully more directly impact the condition itself. Whereas things like medications, as you mentioned, they sort of your body gets washed in them, and so parts of it gets to the brain to indirectly impact the function of the brain, but it also goes to a lot of other places, which can cause things like side effects, and other sort of unintended consequences. Psychotherapy, a similar sort of idea in that we're using social interaction, conveyance of certain information or experiences in order to be able to change the way that the brain is operating. So again, more indirect approaches to shaping brain function. I'd say some of the potential disadvantages are, at the moment, most of the brain stimulation approaches that are utilized are fairly time intensive. So for example, a course of repetitive transcranial magnetic stimulation, or we'll just call it RTMS for short to make it a little bit easier on us. That requires most commonly people to come in once a day for usually somewhere between 10 to 30 minutes to receive their brain stimulation treatment, but then that's done Monday through Friday over the course of about 4 to 6 weeks. So that's, kind of onerous on people to have to come into the doctor's office Monday through Friday for, 4 to 6 weeks in order to be able to receive that treatment approach. Psychotherapy is a little bit less. Typically you come in once a week and you probably have some assignments and homework that you do outside of the face-to-face session with the therapist. And of course, medications are the most convenient because you can take them pretty much anywhere.
Right. Yeah, thank you for that. And what types of brain disorders are currently being used or tested with these brain stimulation techniques?
So the major depressive disorder, or specifically treatment-resistant major depressive disorder, is the condition that is most widely treated with brain stimulation approaches. And typically that's RTMS, or electroconvulsive therapy. But it's also being investigated for other conditions, for example, nicotine dependence. So if you're addicted to cigarettes or tobacco, there is the FDA just approved a form of brain stimulation treatment for that. They're also being investigated for alcohol use disorder, PTSD. But the primary indication of which I'm aware of is major depressive disorder.
Mm-hmm. And treatment resistant, you mean people who have tried medication or other types of first-line treatments and they have not worked thus far, right?
That's correct.
Okay, cool. Can you tell us kind of what this would look like from a patient's perspective? Like if you're coming in for one of these treatment sessions, what does that actually look like?
Yeah, so from the patient perspective, they would come in and they might fill out some measures beforehand to look at their symptoms or how they're feeling that day. Then they would get escorted into the treatment room. And so that usually has, and let's say in this case it's RTMS, since that's the most common form of treatment nowadays, or brain stimulation treatment. People would come in, there's a chair that they would sit in, and then the RTMS device is located near that chair. So then there's usually a process of targeting that occurs in terms of where the coil that delivers the energy is going to be placed on the scalp in order to hit the right part of the brain. That targeting can be done in several different ways. In the oldest and the classic way it was done was just by finding the part of the scalp where if you hit it or pinged it with a pulse of transcranial magnetic stimulation, you would see the muscle in the hand move. So essentially that's the part of the brain called the motor cortex that controls movement. And so basically people would find that part of the brain, usually on the left side, the left hemisphere, and then they would measure 5 to 6 centimeters anterior to that, so further forward. And so that was kind of thought to be a crude way of finding the part of the brain that we want to stimulate, which in this case we call the left dorsolateral prefrontal cortex. Newer approaches, though, have honed in on other ways to kind of find the right place to stimulate. Some of those involve measuring the size of the head and finding the right coordinate based upon the head shape and size. And then the most advanced approaches now, which aren't really widely utilized in clinical practice, but are utilized more commonly in research, involve targeting based on the way the brain works itself, something called functional connectivity. But typically, the targeting would occur, and then after that, the person would be administered the brain stimulation treatment. And that usually takes somewhere between 10 and 30 minutes, depending on the particular protocol. And it's pretty loud, so they would get earplugs. And so that way it would, sort of minimize the noise complaints. But and then it kind of is a little bit like typically the TMS pulses will cause the scalp to twitch. And so if you were to take a video of yourself having this done, you'd probably look kind of funny because your face would be twitching a bit. But it's relatively not painful. Sometimes the most common side effect people report is a headache, but pretty well tolerated by most people.
That's really, really interesting. Yeah, and I like the idea that you can kind of target different brain areas like you were describing. Like we think the left dorsolateral prefrontal cortex is really involved in depression, but maybe for substance use disorders, it's a different area, which is an active area of study. So very cool. Thank you for describing that. I would really love to hear from you about what you're up to in this area and how you're using brain stimulation in your own research.
Yeah, absolutely. So we're at the moment investigating another form of brain stimulation called focused ultrasound. So this is, instead of using electromagnetic energy and delivering that to the brain, we're using sound waves. And it's ultrasound, so it's beyond the realm of human hearing, so it doesn't make any noise or anything. But essentially, there's a couple advantages to ultrasound. One is that it can be delivered much deeper into the brain, I guess is what I would say. And the reason for that is that electromagnetic energy, there is a steep drop off in terms of the amount of energy you can get in as you go further out from the coil. And so for that reason, our TMS approaches really can only deliver energy to the outer shell of the brain, we might say, which is called the cortex. But ultrasound, on the other hand, particularly focused ultrasound, doesn't have that limitation. So we can actually target much, much deeper in the brain. And so that's really exciting because a lot of the affective disorders that I'm interested in things like depression or PTSD, we know involve dysfunction of some of these deep brain areas that are involved in emotion, arousal, and we know that those areas are often hyperactive in these conditions. And so using ultrasound, we can actually try to directly modulate the function of those regions, whereas with something like TMS, we would instead have to try to activate the cortex to indirectly change the function of those deep brain areas. So we discovered a particular sort of, I guess you could say, parameter set of ultrasound, which relates to the repetition of the pulses and things related to basically the way that the waves are delivered. That seems to inhibit the amygdala. So we have some preliminary data showing that this can actually change the amygdala activation if you're looking at something called a functional MRI scan or like a brain imaging protocol. So that's the other advantage to this technology, is that we can actually combine it with non-invasive brain imaging approaches like functional magnetic resonance imaging and deliver it inside the MRI scanner to be able to look to see how the brain is responding in more of a real-time fashion. You can do this with transcranial magnetic stimulation, but it's much, much more complicated because of the fact that you have one magnet inside another large magnet, and so that oftentimes causes some problems between them. So deep, we can hit deep brain areas. We seem to have a setting on this or parameter set for ultrasound that inhibits the amygdala. And so now we have a study going where we are looking at acutely how ultrasound impacts the amygdala, both during functional MRI, and then as well as how that changes responses to various emotional stimuli that we present to the person inside the scanner. After that, people that have a affective disorder, it could be depression or anxiety or bipolar disorder, for example, are going through a sort of a chronic treatment course where they would come in once a day, Monday through Friday, and receive this ultrasound procedure targeted to the left amygdala outside of the scanner. And the idea is that hopefully if we do it daily, that will have a sort of cumulative effect where doing that each day will hopefully tamp down on amygdala activity, and that might have a therapeutic effect on their symptoms.
Mm-hmm. So many questions on my end, but I'm going to try to keep this focus. Very cool stuff first, but how long do you anticipate those effects to last versus something like a medication you mentioned you have to take every day? So once you undergo this treatment course, do you have an idea for how long this lasts or how frequently people have to repeat?
That's a great question. We don't at this point. So we know from some of the prior work that the effects, at least as far as I know, the longest it's been shown to work is days to hours afterwards, or sort of a single procedure. And so it's an open question at this point. And I believe that was in macaques, so it wasn't in humans, or it was in a primate model. And so it's an open question in this point in terms of how long one administration session could have a therapeutic effect or change the way the brain is working. And so we're kind of trying to go for a more give them as much as we can, I guess, over that course of period or that course of time, in the hopes that we're sort of hitting that sweet spot where we're having that therapeutic effect on a regular basis.
Yeah, it just goes to show how much you're really at the forefront of this work and how exciting it is to be pushing the boundaries on these types of techniques. And it's just really interesting to me to think about where we went, from electroconvulsive therapy, where you literally deliver electrical stimulation to the brain, versus more targeted treatments and then using a magnetic field to induce an electrical current in the brain like TMS. And then now you're actually getting at those deep structures, which we haven't been able to get at. So just very cool to see the progression of how far we've come in these techniques.
Yeah, that's a great point actually regarding, ECT or electroconvulsive therapy, as you mentioned, is really a very global approach. We're just kind of shocking the entire brain to, induce a seizure, right? And that it does work. We know that it does have therapeutic effects, but also can have a lot of side effects like memory loss and other kinds of things. So we are very much kind of, as you said, kind of moving from this global sort of, overload the brain with energy approach to much more focal approaches where we're hitting one particular area in a certain way to hopefully have a therapeutic effect.
Yeah, very, very cool to see. I guess a lot of things to be excited about for the future, but in your view, what are you most excited about?
I'm probably most excited about. Another area of mine is of research is looking at the therapeutic properties of psychedelics, which are these compounds that induce these altered states of consciousness that seem to have therapeutic properties. But for me, I'm particularly interested in merging, some of these different treatment approaches. And so we're going to be pursuing a study probably in the next year. It will launch, which is going to be looking at basically trying to pre-treat the brain with a psychedelic. So the way we would think about this is administering a psychedelic in a therapeutic context. And the hope would be that by doing that, we are increasing the brain's ability to optimally receive the energy that we're then going to give to it afterwards. And so the sort of the term that we're been throwing around is this idea of neuroplasticity, which is the brain's ability to kind of rewire itself or reshape it the way it functions in response to its experience and changing environmental demands. And we know that psychedelics seem to promote an enhanced degree of neuroplasticity. So the hypothesis that we have is that if that is the case, then we should be able to, the brain should be sort of optimally conditioned at that point to receive the brain stimulation approach, which might enhance the efficacy of both conditions or both treatments. So that's something where I'm particularly excited about, is looking at this sort of sequencing of some of these newer treatments and seeing how they work in tandem potentially to really improve outcomes for people.
Yeah, and kind of best of both worlds, taking very exciting, new treatments coming down the pipe for psychedelics and then merging it with your exciting brain stimulation techniques. And I know that's probably part of your new center. Would you like to share a little bit about that?
Yeah, absolutely. So we just in December of 2021 launched a Center for Psychedelic Research and Therapy here in the Psychiatry department at Dell Medical School, UT Austin, and it's really exciting. It's an area I've been interested in for a while, and now it's really kind of exploding in terms of the popularity of this as a potential treatment approach. And so we are going to be launching some studies in the coming months to years, obviously, but it is we're really focused on a couple things. One is trying to sort of optimize how we're delivering the treatment. At the moment, I think it's not personalized at all. It's really, everybody sort of comes in, gets the same drug, the same approach in terms of the therapy that's given along with the drug. And it, that being said, it does seem to work, right? On average, people get better, depending on the condition and the drug and all those factors. But really, I would imagine there's a lot of individual variability in terms of how what the right dose of the drug should be, what's the right psychedelic to administer someone, what should the therapy protocol be around that. Can we enhance that with other adjunctive approaches? So really trying to optimize the delivery of the approach, personalize it to the individual, and then really try to understand neurobiologically, like what's going on in the brain that allows people to receiving the psychedelic treatment that allows them to improve and recover from things like depression or anxiety or post-traumatic stress disorder. We have some knowledge regarding how a psychedelic impacts the brain generally, but in terms of long term, after the effects wear off and the person is back to a more baseline level of consciousness, what is it about that after period that really allows people to get better? And we know they get better quickly. So it's a really exciting area.
Yeah, and that's one of the things we talked about in our prior psychedelic episode is that just how quickly these effects happen, where something like antidepressants, at least typical SSRIs, take weeks to set in. So it's really, really exciting. I'll say that once again. But how can people learn more about you and about your research in this center?
Yeah, so I have a lab website which I can distribute. I can say it over. It's sites.utexas.edu/Fonzo Lab.
I'm impressed you memorized that. We will also link to it in the bio of the podcast.
That's good. Yeah. So the center website is a longer URL, so I don't remember that.
I won't test you then, but we will definitely link to that. And then I guess final question, if someone is interested in learning more about these techniques that you mentioned, or even trying some of these experimental therapies, or in the case of treatment-resistant depression, actually trying it, what do you recommend?
Yeah, so it would depend on what they would want to try, I guess. So some of these treatments are available in clinical settings as regular sort of FDA-approved approaches, like rTMS, for example, for depression. So in those cases, it's much easier to Google local providers in your area that might deliver this treatment. The experimental treatments, some of the things like the focused ultrasound and the psychedelic approaches are much harder for people to avail themselves of at the moment because of the fact that they're not FDA approved, and so therefore they have to be done in a research setting under an approved research study. So in those cases, I think a good resource is clinicaltrials.gov. You can go on there and you can put in keywords and search for clinical trials that are ongoing. And basically, if there's any kind of treatment study going on in the U.S. that it will be listed on clinicaltrials.gov. So it's a great resource for people to be able to locate studies, and then each study will have contact information. So then from there, I would say try to find somebody that's as close to you as possible. Reach out to the contact person, and then see what the process might be to get involved in that study.
Yeah, that's very, very helpful. And I'm really excited to have you back on in a couple years and hear more about this research. And thank you so much for your time. This was wonderful.
Oh, thank you. It was great to be on.
That wraps up another episode of the Brainstem podcast. Thank you so much for listening. Please subscribe and share this with friends and family. And be sure to follow us on social media at Brainstem Podcast.